Hi, this is a video for all my little champions who undergo surgery. They ask me a lot of questions and they keep me on my toes. So this is Dr. Kant Shah, Pediatric Surgeon, and if you are one of those champions that has been asked to undergo surgery and you have a lot of questions, then this video is for you, that I'm going to tell you what happens in your surgery. Okay, so just relax and I'll tell you exactly what we do. Okay, first of all, any surgery is done under complete anesthesia. So what is anesthesia? We would usually give you a little mask. You have to inhale some nice smelling gas and you go to sleep. Okay, when you go to sleep, then we may put an IV line in your vein which you don't feel and continue the anesthesia and then continue to surgery. Sometimes more injections may be given in a completely painless manner to keep you pain free for even days after surgery. Once we've anesthetized you, what happens is that we do the surgery by laparoscopy or open surgery. Open surgery usually we only do when the cuts are going to be very small, and if we are going to do laparoscopic surgery, they are only keyholes. So what is a keyhole? About 5 millimeters, sometimes even 3 millimeters. If we are doing robotic, it's slightly bigger at 8 millimeters. So we are talking anything less than 1 centimeter. In school, if you have seen 1 centimeter, it's even less than that. So all the holes are very small. We put a camera through one of the holes and some instruments through the other holes and do all the surgery inside. And then once the surgery is done, you are woken up. The next question that most of you ask is, do you feel the surgery? No. Surgery is like going to sleep. You will not feel, understand, realize, remember anything of this. It's like going to sleep, waking up, going to school. Okay? So you will go to sleep, you will wake up, you will be in the ward, sometimes in the ICU, but mostly in the ward, with your parents by your side. You have to stay there for a few days until whatever organ we have operated on is completely functioning well and we can let you home. Okay, that may be 1 or 2 days, that may be a week or so. So, will you get pain after surgery? Well, all of us get pain even if it's a small scratch. Then with a keyhole or a small open surgery also there is some pain. But what do the magic anesthetists do? They actually give you anesthesia, which is painkillers, which last you for hours and sometimes days. And then we give you some syrups or tablets if you're a big boy or a girl, and you can swallow those and take good painkillers. And those are not nasty at all. Those are the regular painkillers that you are used to taking at home for any little injury that you get. So yes, there is some pain that is very easy to control with simple painkillers, and that's all you will need after your surgery. Most of you will be up on your feet within 24 hours after surgery. Most of you will be eating your normal food within 24 hours after surgery. You may have to stay a little longer for all the medications and antibiotics and all that. Or as I said, the organ that we have operated on, like a kidney or something, which is completely recovered from the surgery or the problem that we were solving. So, two most important questions. When can you go to school? Well, almost all the surgeries that we do by laparoscopy or robotics, or even the small open surgeries, you can go home within the day or two. You can rest for about a week, and within a week you can go to school. Okay, if you promise not to do masti in school, if we think that you are naughty and you are going to do masti, we may have to keep you out of school for a little longer. Second most important question, when can you play? Again, you can start playing within a week, but you have to avoid some sports for about a month. Okay, because like all sports injuries, all the big sports stars get injuries and then they have to stay out on the bench for a month or two. Similarly, we want you to recover completely from your surgery, and hence you have to be out on the bench for a month, no sports. Okay, but you can go to school, you can play with your friends, you can do most of the other things. And after a month, magic. You can do everything that you were doing before, and there is no restriction in your life. You can have a completely normal life after laparoscopic or robotic surgery. I hope that this answers most of your questions. I'm sure you will have more. So please write down in the comment section, and please like and subscribe my channel. I will subscribe yours too if you send me a link, and we will see you on the other side. Bye bye.